Welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness. Today, we are continuing the conversation about prednisone and talking all things side effects. If that sounds like something that you're interested in, make sure you hit subscribe and like. That really helps us out. I know that there is not enough time in our doctor's appointments, and I also know that sometimes we just don't know what the right question to ask in order to get the information that we want and we need. And that is why at the end of most videos, I like to include questions for you to ponder, for you to think about, take home, and then take with you to your next appointment to kind of keep the conversation going and get you the information that you need in order to get you back on the road to health. So let's get started. So the thing about prednisone side effects to keep in mind is that not everyone is going to have all of the side effects. There are acute side effects. These are side effects that can happen within a few days to weeks of starting prednisone, and there are the chronic side effects, which are the effects that can happen months or even years after being on prednisone. The other thing to keep in mind is that side effects of prednisone, for the most part, are dose and duration dependent, meaning that your risk of developing any of these side effects goes up when you are on a higher dose and on prednisone for a longer period of time. Now, if you haven't already, I really recommend you watch last week's video where I really break down what is prednisone, how we use it, how we think about it, and the doses that we use. And if you watch that video, you'll know that I am using the word prednisone to kind of mean all of the glucocorticoids that are out there. Prednisone is the one that rheumatologists use the most, and it's just rolls off my tongue a lot easier. But when I'm saying prednisone, I could be talking about hydrocortisone, methylprednisolone, or any of the others that are out there. The other thing I just want to mention is that a lot of these side effects can happen even if on a low dose of prednisone. There is no quote-unquote safe dose where you don't get side effects. And it's just important to know, not because I don't think if you need it, you should take it, but you just need to know that regardless of the dose that you're on, being knowledgeable of the potential side effects is still important. Okay, so let's just dig into this. I'm going to be going through these side effects based on the system that's involved, and as we go through them, if applicable, I'm also going to be giving you some tips and tricks on what you can do to prevent these side effects. So let's talk about the skin. So the skin tends to be affected when someone has been on prednisone for a while. I am being purposefully vague there by saying a while because it's going to be different for everyone. Sometimes this can pop up after a few months, sometimes after a few years. People will have skin thinning, they can get bruising, specifically on the backs of their hands and on their arms. People can notice water retention, feeling just generally puffy and actually getting swollen legs. Weight gain is very common when on prednisone. This is because of a number of reasons. Water retention is one of them, but also we can have an increase in appetite. And we can also develop what textbooks call a Cushing appearance. And this is fat redistributing to our trunk, our chest, our upper back, and our face. Next, we have the eyes. So it's important to get your eyes checked regularly. Cataracts can be seen in people who have been on prednisone for a long time. Also, we can have elevated pressures within our eyes. Thankfully, it's not as common when you're taking prednisone by mouth. That's something that's more common when you're using prednisone drops for the eyes, but still an important reminder to get your eyes checked regularly. Next, we're talking about the cardiovascular system. So it's super important that we talk about this because a lot of times people don't even think about it. So being on prednisone for a while, again, being vague on purpose, can lead to elevated blood pressure and can ultimately, years down the road, put someone at risk of developing atherosclerosis disease and cardiovascular disease. What does that mean? Higher risks of strokes and heart attacks. Now, this is difficult because it's not something we feel. It's not a side effect that changes our appearance, and it's something that happens way down the road. But we need to be thinking about it now so that we can prevent it then. And the things that we can do now, if we need prednisone, is going to be controlling our blood pressure, whether that's with diet or with blood pressure medicines. We want to make sure that our cholesterol is in line, whether again with diet or with medications. We want to do all that we can for all the other risk factors out there to really try to mitigate as best as possible this risk that prednisone kind of introduces us to. Okay, the gut. So prednisone has a way of really tearing up the gut, or it really can tear up the gut. So gastritis, esophagitis, ulcers, in severe cases, ulcers that then lead to bleeding. Now, a bleed in our stomach or in our intestines is not something you want to mess around with. It is an emergency. These bleeds can be life-ending. Thankfully, bleeds are not as common, but it is common to get an upset stomach, nausea, and gastritis when on prednisone. This risk is even higher if you also are taking the non-steroidal anti-inflammatories, things like ibuprofen and naproxen and diclofenac. That combination of ibuprofen and prednisone can really do a number on your stomach. And in general, if you need to be on prednisone, we recommend that you don't take those other medicines. Now, there is something you can do to prevent this side effect, and that is taking a daily antacid. I am well aware and do not promote long-term use of a medicine that requires another medicine for its side effect, and then before you know it, you're carrying around a pharmacy. So I am no way saying that this is a long-term or a good long-term strategy, but we have to acknowledge that an upset stomach and gastritis and ulcer development is a potential side effect of this medicine that is life-saving. And so in order to mitigate that side effect, you can use an antacid. Naturally, the goal is to be able to get off the prednisone, which will then enable you to get off the antacid. Okay, let's talk about bones and muscles. So osteoporosis can be seen when people need to be on prednisone for long term. Now, what is osteoporosis? I know a lot of us get confused between osteoporosis and osteoarthritis. Osteoarthritis is a condition of the joint. Osteoporosis is a condition of the bone. In osteoporosis, the architecture of the bone is altered and weakened and makes us more susceptible to fractures. It's not something we feel. It doesn't cause pain, which is good, but also bad because we then tend not to think about it. And when we're on prednisone for longer than a few months, we need to be thinking about our bone health and preventing osteoporosis. And the way we can do that is by taking calcium and vitamin D and doing muscle strengthening exercises. Something else that can happen to the bones is called osteonecrosis. This is where areas of our bone can not receive the amount of oxygen and nutrients and blood flow that they need to stay healthy, and that can result in islands of bone death throughout the bone. Now, a lot of times this might not cause any symptoms. Depending on where these islands are within the bone and how close they are to the joint can determine if someone has any symptoms or not. And then ultimately, I just wanted to touch on the risk of developing myopathy, which is just a fancy word to saying a disease of the muscle or muscle weakness. Okay, so let's talk about the brain and the mind. So some side effects that we see with prednisone right away, meaning within a few weeks of starting it, can involve mood changes. And the mood changes can be all over the board. It can be anywhere from depression to anxiety to psychosis. And as scary as that might sound, and it can be scary, it is controllable with either decreasing or removing the prednisone and certain mood altering or antipsychotic medications. Now, most of the time, this does not result in a long-term mood disorder, but it is something to be aware of and to notify your doctor of if you or family members notice any changes. Another key side effect that can happen actually within a few days of starting prednisone is insomnia. Prednisone, especially at the higher doses, can be very activating and can make getting a good night's sleep difficult. We also need to talk about metabolism. Now, taking prednisone will elevate your blood sugar, especially after eating. For those with diabetes, this can become problematic, especially if their blood sugar was already difficult to control. This can lead to needing a change of the diabetic regimen, perhaps using more insulin to accommodate for the elevated sugars that taking things like prednisone can cause. Now, for those who require or end up on prednisone long-term, again, long-term can mean months to years, it is possible to develop diabetes that will persist even after the prednisone has been stopped. Thankfully, this isn't as common as we once feared, but still something that we need to be cognizant of to really make sure that we are aggressive in trying to get off our prednisone. The other effect on the endocrine system that we want to keep in mind is the general suppression of our HPA axis. And if you don't know what I'm talking about, again, I encourage you to go back and look at last week's video where I described that hypothalamus, pituitary, adrenal axis and how it works and what it does. But in general, this axis, and specifically our adrenal glands, are really shut down whenever we take prednisone. You know, prednisone is just a man-made version of cortisol. And when we take it, our adrenal glands don't need to work. And so when we are trying to get off prednisone, sometimes we get anxious, we get frustrated, and we want to just come off this medicine. And we can end up doing it too quickly. And we do it so quickly that our adrenal glands don't have a chance to wake up. And we end up then in a state of hypocortisol in our system, meaning not enough cortisol in our system because we've now taken it away from our mouth where we're not taking it, and our adrenal glands haven't woken up enough to be able to produce it. And in severe cases, this can result in an adrenal crisis that can have very devastating outcomes. So it's important to understand that, and the best way, if frustrated with the prednisone that you're on, instead of just trying to get yourself off of it on your own, is to go back to your doctor and have discussions about how to get off of it safely. And then finally, we have to talk about the immune system. Now, we use prednisone in rheumatology because someone's inflammation has gotten so out of control that is now threatening organs or quality of life. And that inflammation has gotten out of control because of the autoimmune condition that someone may have. And our best, most effective, fastest way at bringing down that inflammatory response is with medicines like prednisone. But by bringing down that inflammatory response, we are also bringing down our immune system's ability to fight off infections. And so infections, both mild and severe, are side effects or effects that we see from prednisone use. And These effects can be seen if on prednisone only a short amount of time or for a long amount of time. Now, one thing I always like to remind patients of, or people who are worried about this particular side effect, and I think the past 2 years have made us all hyper aware of infection risks and those kinds of things, is that when you have an autoimmune condition, especially one that is not well controlled, you are already at risk of developing both mild and severe infections. I like to think that in autoimmune conditions, the immune system is revved up but ineffective. So it's not uncommon to see patients in the hospital with severe infections who aren't on any treatment, but their inherent autoimmune problem has made them at risk for developing this severe infection, as well as patients who've been on prednisone for months to years who can end up with the severe infection. Our best defense against this is to control the autoimmune condition and bring down the inflammation, even if that means the way we do that is with prednisone. By doing it in a controlled way, under supervision, and possibly even with antibiotics. We will sometimes use antibiotics to prevent certain serious infections when someone has to be on high doses of prednisone. But doing it in a controlled way under the supervision of a doctor is really the best way to prevent the infections all around. And of course, we can't talk about prednisone use and infection risk and autoimmunity without talking about the other things we do to prevent infection. Now, I mentioned that sometimes we'll use antibiotics, but just old-fashioned hand washing and vaccines and mask wearing can do a lot to prevent us from getting infected when we require these types of medications. If you're pregnant and need prednisone, need to be on the lookout for gestational diabetes or preeclampsia. Preeclampsia is a condition with elevated blood pressure. So despite this lengthy list of possible side effects that I just went through, we have to acknowledge that prednisone and its sister medications have undoubtedly saved lives. We use these medications when people are facing the most severe forms or complications of an autoimmune condition. When someone's major organs, whether it be heart, brain, kidney, lungs, whatever, are being affected, or when someone's quality of life is severely affected. These medicines can truly save and alter lives for the better. But we also need to treat them with respect. These are medications that come with a price, and we have to be cognizant of that, and we have to be aware of that and do everything we can to mitigate the risks. So what are some things that you can bring up with your doctor to make sure that you're on the same page about how you're using the prednisone and how you can get off of it? So number one, simply ask, what's our strategy to get me off this prednisone? How long do you anticipate I'm going to need it? And what are you looking for, and what should I be looking for as signs that show me I'm at a point to where I can safely come off? Now, just as a reminder, these are not questions I'm suggesting because I think they are easy to answer. In fact, I know that they oftentimes aren't. But they're questions that I know can lead to important and constructive conversations between you and your doctor. The next set of questions: what can I be doing? What other medications should I be taking to prevent some of the side effects that are possible with prednisone? And we've talked about a lot of them. Taking an antacid to protect your stomach, or possibly taking an antibiotic to prevent a severe infection. Perhaps you need to have your cholesterol checked. Do you need blood pressure medicine? And then, of course, calcium and vitamin D are always going to be good additions to protect your bones. And then finally, talking about any signs or symptoms that you need to let your doctor know about immediately should they occur. We talked a lot about some long-term side effects, but we also mentioned some side effects that are going to happen within a few weeks of starting prednisone. Now, of course, knock on wood, these things never happen, and hopefully you never have to cross that bridge. But I always prefer to have a game plan just in case. You know, how to best use and get off prednisone is really an art form. Every rheumatologist has their own way of doing it, and their method has been forged from obviously the literature, but also their training and their own personal experience. And I am certainly not in the business of telling rheumatologists how to practice. But I have seen how prednisone can be used and treated without the respect I believe it deserves. And it can result in patients being on prednisone for probably longer than necessary and leading to some undesirable effects. On the other hand, I've seen how the fear of prednisone can prevent someone from completely turning around their condition and turning off this perpetual out-of-control inflammation that might be going on. I believe that there are ways to utilize prednisone and reap its benefits while also mitigating the potential risks. I think the best way to at least start this process is by speaking up and getting on the same page as your doctor. Discussing these issues will help you understand what the game plan is. Why are you using it now? And how are you going to get off of it? So that's it. Those are the dangers of prednisone, the side effects to look out for, with some tips and tricks in there about how to prevent them. I hope you found this useful. I know prednisone is scary. I know a lot of people have a lot of opinions about prednisone on both ends, pro, con. I mean, actually everyone's kind of con against prednisone for good reason, but I think that it's important to understand what it can do for us while also acknowledging the price we pay. So I hope you enjoyed it. If you like this video, make sure you hit subscribe, make sure you hit like. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness because it's all connected. Thanks, and we'll see you next time.